So today we'll talk about some drugs that we use in treatment of glaucoma. What is glaucoma? It is a condition in which the pressure inside your eyeball, your intraocular pressure is increased. So how does this pressure increase? There is this thing called aqueous humor in your anterior chamber of the eye. In the anterior chamber, in the anterior compartment, you have your aqueous humor. In front of your lens, anterior to the lens, you have aqueous humor, and behind your lens, you have vitreous humor. Your vitreous humor, uh, once it is formed, it stays there, but your aqueous humor is actively secreted all the time and also resolved. So I have drawn this diagram and we'll try to learn a few things from this. So this is your lens, these are your ciliary bodies, this is your iris, here you have your iridocorneal junction, your iridocorneal angles. So aqueous humor, here you have your aqueous humor. Your aqueous humor. So as I told you, it is formed by these ciliary bodies, then it moves up here, then here, and it finally gets drained via your uveoscleral outflow. All those, your canal of Schlenn and everything, it drains this aqueous humor. So whenever there is increased production of aqueous humor by ciliary bodies, or if there is decreased drainage of aqueous humor by a uveoscleral outflow, then it can lead to increased intraocular pressure, and it can lead to condition which is called glaucoma. So for glaucoma, your intraocular pressure should be more than 21 millimeters of mercury. Then we call it glaucoma. Then we'll talk about a little more concepts which will help us understand the drugs that we are going to use in glaucoma. So here at your ciliary bodies, you have these tiny blood vessels. Then you have a lining epithelium of the ciliary body. So we'll talk about these a bit. So at your these blood vessels right here have got your alpha 1 receptors, and when stimulated, these alpha 1 receptors decrease the production of aqueous humor. How? Your blood vessels have alpha 1 and beta 2 receptors. Alpha 1 constrict the blood vessels, decreasing the flow, decreasing the production of aqueous humor. Okay, then you have the lining epithelium here. The lining epithelium of your where's the green color? You have your lining epithelium of ciliary body. So first the blood vessel give the fluid to the epithelium, which then secretes it as aqueous humor. So your epithelium has a few receptors. These are your alpha 2 receptor, your beta 2 receptor. So stimulation of alpha 2 receptor decreases production, decreases secretion of humor. Beta 2 stimulation increases secretion of humor. And epithelium also have this enzyme called carbonic anhydrase, and this enzyme also increases secretion of humor. Okay, so blood vessel was producing humor, giving it to your epithelium, then your epithelium was secreting the humor, and these all were the receptors present and your enzyme carbonic anhydrase. So let's uh, talk a little bit about what all drugs we are going to use. But before that, these all were the factors influencing the formation. What all can influence the drainage? There is this thing called prostaglandin F2 alpha. This increases the outflow of humor, and also your alpha 2 stimulation increases outflow. Alright, now so drugs used in the treatment of glaucoma are as follows. We'll write the drugs here. First you have what is called your beta adrenergic blockers, your beta blockers, available as topical eye drops. What all beta blockers do we use? We use what is called timolol, levobunolol, and cartiolol. You can just remember your timolol. All three of these are non-selective beta blockers. That is, they block both beta 1 and beta 2 receptors. Also you get betaxolol. Now this betaxolol here is beta 1 selective. It blocks beta 2 as well, but major effect is on beta 1. So where are we going to use it? We can use it in patients who have asthma as well as glaucoma. Because beta 2 receptors are present in your airway, and in asthmatics, if you block these beta 2 adrenergic receptors, it can lead to further deterioration of the symptoms. So we use betaxolol, which is beta 1 selective. Moving on, so you can understand how these are working, right? These are beta blockers, and we just saw that this beta receptor was present, which was increasing secretion, and other beta receptors are also present. So if you block these, it will lead to decrease in intraocular pressure. Then you have your alpha agonists. Next category of drugs used in glaucoma are alpha agonists. So beta blockers and alpha agonists. What all alpha agonists do we have? We have drugs which work on alpha 1 receptors mainly. Examples include dipivefrin, and we have drugs acting on alpha 2 mainly. These include your apraclonidine and brimonidine. Apraclonidine and brimonidine. Okay, then I told you about this PGF2 alpha. So we can use prostaglandin analogs. These are basically PGF2 alpha analogs. The names or end with the word prost for prostaglandin. So examples are latanoprost, travoprost, and bimatoprost. Okay, then I told you about the carbonic anhydrase enzyme, which was increasing the secretion of your humor. If we inhibit this enzyme, it will lead to decrease in intraocular pressure. So we'll use carbonic anhydrase inhibitors. Next category is carbonic anhydrase inhibitors. Well, carbonic anhydrase inhibitors include the drugs dorzolamide and brinzolamide. Okay, so carbonic anhydrase enzyme was responsible for increasing secretion. If we inhibit this enzyme, less aqueous humor will be formed and intraocular pressure will fall. You know other carbonic anhydrase inhibitor, acetazolamide, but we don't use it here except in cases of acute congestive glaucoma. So like your acetazolamide, you have your dorzolamide and brinzolamide here. Now, there are different types of glaucoma. There is open angle glaucoma, there is angle closure glaucoma. How do these differ? We'll come back to the diagram. You know, there at the outflow there is this thing called iridocorneal angle. Now, if this angle is open, we call it open angle glaucoma, which is due to increased formation of humor, or if there is some problem in the outflow pathway. And if this angle is narrowed down, it will hinder the outflow of humor, and we call this condition angle closure glaucoma. So you should know that whenever your iris whenever your pupil size increases, your iris actually kind of sags down here. So it kind of sags down here and it narrows down the angle. And whenever the pupil size decreases, the iris here becomes kind of thinner and the angle opens. So in cases of angle closure glaucoma, the drug of choice or the first line drugs for angle closure glaucoma are your miotics, so that your this angle, your iridocorneal angle, can open up and the outflow can be increased. So next class is your miotics, which are your first line drugs for angle closure glaucoma. Angle closure glaucoma. Examples include pilocarpine, then your physostigmine, and ecothiophyte. So miotics are the first line drugs for angle closure glaucoma. What about your open angle glaucoma? For open angle glaucoma, there is some problem in the outflow. The angle is wide open, so we'll have to increase the outflow. So what did we use to increase the outflow? Your prostaglandin F2 alpha. So we'll use prostaglandin analogs like your latanoprost. So these are your first line drugs for open angle glaucoma. Open angle glaucoma. Then again, you have this emergency condition of the eye. Emergency condition which is called acute congestive glaucoma. Acute congestive glaucoma. We have to decrease the intraocular pressure very fast, otherwise it will lead to damage to your retina. So the drug of choice in your acute congestive glaucoma is actually intravenous acetazolamide. I talked about acetazolamide a little bit when we talked about carbonic anhydrase inhibitors. Acetazolamide and your mannitol. IV acetazolamide and mannitol are used in acute congestive glaucoma. And that's all.